Hi, everyone. Thanks for having me today on Facebook Live. My name is Dr. Shafali Jeste. I'm a pediatric neurologist at UCLA and an associate professor in neurology, psychiatry, and pediatrics. I'm also a board member of the American Brain Foundation, and I'm really happy to be talking with you today. I specialize in neurodevelopmental disabilities, which we'll talk a little bit about today, and I direct a multidisciplinary clinical research program at UCLA called Caring, which is a multidisciplinary team effort to help take care of kids and adults with really complex neurodevelopmental disabilities, often those that are caused by different genetic conditions. And so during this time, this very challenging time, I know for many of us during this COVID era, if you will, we've been really thinking hard about how best to help our families of kids and adults with neurodevelopmental disabilities. And so that's what I'm going to talk about today. I did first just again want to thank you for joining, and I hope you're all staying safe and well and finding ways to still be connected either through Facebook Live or other platforms. Because as I always say to my patients and to my friends and everyone that, physical distancing does not mean social isolation. It's really important to try to stay connected to others and to not let yourself feel isolated. And that's true for our patients and for our friends. The question I was actually asked was to talk about, again, COVID for individuals with neurodevelopmental disabilities. And first, just to put it into context, 1 in 6 individuals in this country has a neurodevelopmental or developmental disability. So these conditions affect many, many, many millions of folks. What are neurodevelopmental disabilities? Those include conditions such as autism, intellectual disability, global developmental delay, ADHD, and other conditions where we think and we know that the symptoms really emerge early in development, but that absolutely affect the way an individual experiences their entire life into adulthood. And so these individuals often need help and services and supports throughout a lifetime. Now, as a neurologist, I, again, specialize in these neurodevelopmental conditions, but I also see them because a lot of these neurodevelopmental conditions have neurological comorbidities. What I mean by that is associated conditions like epilepsy, especially, and as they get older, other even neurodegenerative conditions. We also know that these individuals often struggle with other psychiatric comorbidities like mood disorders or anxiety, depression, things like that. And so we really do have to help families and kids and adults with a lot of these different issues. And so the first question I'm going to tackle this quickly because it's not actually the scope of what I want to really talk to you guys about today. The first question I get asked often is, are these individuals, and I'm going to say kids as I move forward because I'm a peds neurologist, but this really does apply to adults also, and I do take care of a lot of adults with developmental disabilities. But the question I get asked is, are these children at higher risk for actually contracting COVID? And the short answer is no, in the sense that it's not that by virtue of having a neurodevelopmental disability that you're more immunocompromised or more susceptible to getting sick. What I will say, though, is that a lot of our patients have significant motor delays and low tone or hypotonia that can actually affect the way they even clear secretions, the way they're breathing, especially at night. And so that could lead to more challenges in like clearing sort of simple respiratory infections. So that's one sort of consideration that we do take. The other really important consideration from the standpoint of COVID is that they may not be more likely to get sick from COVID, but because of the fact that they have other challenges, especially if they have epilepsy, if they do get sick with COVID or any other viral illness, they're more risk for getting sicker in other areas as well. And again, epilepsy is probably the best example of this. So my patients who have seizures are definitely more at risk for having worsening of their seizures if they're sick and have a fever and other sort of stressors to their body. So it just means that we have to be really hypervigilant. And I'm always advising my patients to just really be careful about, taking precautions from the standpoint of having their child not be exposed to the potential for getting sick with COVID. The other piece of advice I give to my patients around just specifically COVID illness is that sometimes our kids, especially those with more severe developmental disabilities, meaning kids who might have significant cognitive delays or challenges or be nonverbal, if they feel sick or have a medical condition ongoing, they are not going to necessarily tell us that their throat hurts or that they are having trouble breathing. They're going to manifest their illness in a lot of other ways. They may just seem a little more sleepy. They may seem a little less alert and coherent than they normally would. They may be sleeping really poorly. They may not want to eat. Their seizures may get worse, which is something I think obviously more easy to kind of quantify, but they're not going to tell us in so many words often. And so I always am advising parents and clinicians to be more vigilant about looking for other symptoms that might herald an illness. So these are the kinds of discussions, again, where I'm having with patients and parents of kids with neurodevelopmental disabilities, but really, again, the long story short on the illness piece is that it's not that kids with neurodevelopmental disabilities are necessarily higher risk for contracting COVID, but they may end up experiencing the sequelae of a simple viral illness, or not so simple, but a viral illness in a way that's really more harmful than it might be for a typically developing child. So we have to be really aware of that. But what I really wanted to talk to you about, in again, about 10 minutes or so, is that, one of the really sort of big unintended victims or consequences of the COVID crisis and the restrictions that obviously all of us are facing is that it's led to our kids really struggling to continue to get access to key educational and interventional resources that they really rely on a day-to-day basis. And it's also led to them struggling to get access to really necessary medical care, especially for those kids who have more complex neurodevelopmental conditions. And so what we're seeing, and what I started seeing when I started to do telehealth at UCLA, and we've switched very quickly to telehealth, which was fantastic, was that parents were really stressed and struggling because now all of a sudden, not only were their kids not in school, but they were not receiving any of the services they were getting in school, like their speech therapy, their physical therapy, their occupational therapy. And school itself, is a place where kids with neurodevelopmental disabilities receive so much support, so much structure. Often these kids have one-on-one aides in school. The entirety of their, again, educational and kind of developmental resource portfolio is in school often. And imagine now losing all of that and being at home. That is a huge challenge. And then on top of that, to not have the same access to the medical providers that they, often see regularly, it was something that our parents were telling us was very stressful. And so what we actually did, and when I say we, it was a collaborative effort with investigators and clinicians around the country, as well as parent advocates, is we actually put together a survey, which we called Caring Through COVID. And it was a survey of families of both kids and adults with more severe neurodevelopmental disabilities. So folks who have kids or adults with genetic conditions that are associated with things like, again, intellectual disability, autism, epilepsy, and other conditions. And we asked about the impact of the COVID restrictions on their experience. And we actually just finished pulling together all those data, which will be hopefully published, but also I wanted to share some basic snippets with you so that we can then think about how we use that information to guide families. And again, eventually down the road to also develop some programs for them. So the survey ended up being sent out to patient advocacy groups. It went to the Autism Science Foundation and all of their readers. We sent it to different autism centers, and they sent it out to their patients and families. And we also went through a very large platform called The Mighty, which has millions of readers a day around different areas. And we received over 1,000 responses, which is really exciting given that we only had the survey open for about a week. Most of our respondents were in North America, but we did have some international contingencies. The diagnoses that people reported were, again, epilepsy, intellectual disability, autism, or developmental delay. Majority were kids, but we did get some data from parents of adults with these kinds of developmental disabilities. And in this survey, the majority, and we asked all these questions, so I'm just giving you kind of highlights of the results. The majority of these kids and adults had been receiving either general education with supports in school for their developmental disability, or else they were in a primary special education environment, either in public school or in private school. And that's very representative of what we see in our patients. They are getting supports in school. And what we learned was that more than 90% had lost some access to these services, either through school or through, again, their private providers. So very, very much impacted. It really fit with, again, my clinical experience of what I was seeing with my patients, but to hear this at a national level was really striking to us. 50% reported losing services that were non-educational, so meaning physical therapy, occupational therapy, speech. The ones that reported continuing to receive some of the services, though, interestingly, did report that they were able to get some of those services through telehealth. And that can be provided in a number of ways. We didn't really dig deep into how those teleservices were provided, but many people were reporting that they were getting telehealth, which was great. We also asked about access to healthcare, and more than 50% of our responders said that they had experienced a loss of access to healthcare, and they mostly reported that appointments were being postponed or canceled, that they were having trouble being able to speak to or reach their doctor, and they were having trouble accessing medications and particularly getting refills when needed. So again, a lot of gaps here that we need to think about how to address. We also asked what was helpful. So that we asked about what they were losing, but what are our families of kids and adults with neurodevelopmental disabilities finding helpful? So interestingly, and maybe you're not surprised, most said that when they were receiving telehealth, they found it super helpful, and that what they really wanted was more access to telehealth. They wanted to have more providers giving them and their child or adult who's at home some guidance, information, even direct therapy through telehealth. The number one, though, thing that parents reported they would love more of is one-on-one therapy at home. They really missed out on having their service providers be able to interact with their family. And unfortunately, that's something that's a little harder that issue is a little harder to mitigate in this era. But I think it speaks to how valuable these individual therapists are for these families. But again, many people said they would just like to see more telehealth available. We also asked about the impact of these restrictions on their child just in the few weeks that we've been in this situation. And more than half of our respondents said that they have seen worsening of mood disturbances, particularly anxiety, behavioral issues like aggression. Sleep issues was a major issue, again, that people reported. And actually about 200 of our respondents said that they also had seen a worsening in their child's seizures over the course of this time period. We asked about the impact on the caregiver, right? Because when we take care of patients with neurodevelopmental disabilities, we want to take care of our families and our parents also. And we asked about both positives and negatives. So we're not trying to just focus on the negatives, but a large proportion of our parents said that they were experiencing anxiety, fear, some frustration around the lack of access to the services that they needed. But having said that, many parents also reported that they really enjoyed having more time with their child and being able to actually see firsthand what kind of supports and services they had been getting in school, and to try to be more a part of that experience. So, again, this will be eventually, hopefully very soon, published in a way that you guys can see all these numbers. But I really just want to emphasize that, in short order, we've been able to really gather information on the fact that our families are struggling with not having access to the same level of educational and interventional supports, but that anything that we can do from the standpoint of giving families access, especially through telehealth, can be helpful. It may not be as helpful for some kids compared to others, but I think the fact that we do systems in place to start implementing some of that is important, and it's something that we need to continue to prioritize and learn more about. Right? We really are now going to be asking parents about what do you find most helpful about telehealth? What would be ways to make telehealth even more impactful? Because just taking a step back for a minute, think about, again, I told you what these neurodevelopmental disabilities include, right? So a lot of my patients, for instance, are minimally verbal. They have significant attentional challenges and some behavioral challenges. it's not easy for a child like that to be sitting in front of a computer doing a Zoom session for extended periods of time. I mean, it's hard for us to be sitting on Zoom all day, hence why I'm wearing my glasses. My eyes are tired from staring at screens all day. And to not be able to move around as much and interact directly with folks. So imagine how much harder that is for a child or an adult with a neurodevelopmental disability. So I think we have to be aware of that and conscientious about that and respectful about that challenge, but also, again, listen to our families that are telling us that telehealth is helpful. It's better than nothing, and it's helpful, so that we should be thinking about ways to make it as effective as possible. So in the last few minutes, what I want to do is now sort of move it from, I don't want to be doom and gloom and just talk about the negatives here. I also want to really think about what is it that we can do as healthcare providers as well as caregivers to help our families. So from my advice to other healthcare providers is for us to be as able, and I totally understand that there's boundaries and we have to be careful with telehealth with regards to how we're communicating with patients. Having said that, as much as we can keep lines of communication open with families, be it through telehealth, be it through email, or through, through our electronic medical record messaging more than email, I would say, to listen to what families need and to provide guidance as much as we can. Because what I found is that even being able to connect with the family for 10 minutes and hear about their questions or their concerns is effective enough, because I can usually give a little bit of guidance or some suggestions that might help our families. And it also just helps them feel heard, right? That they just know that someone who knows their child is on their team, even during this time of physical distancing. I also would say it's, as much as we can help make medication refills as easy as possible, if it's giving multiple month supplies at once, so they're not having to find a way to contact our teams every month to get those refills when our staff are also not maybe as quite as available as they were before. So making that medication management piece as easy as possible, I think, is also really important. And then the last thing I'll say is that I think, and this kind of ties into what I tell caregivers, which is, again, we're a team taking care of our families. And so I think as much as we can encourage parents and give them the confidence and sort of the really positive feedback that right now they are at the complete center of their child, when I say child, I mean kids and adults, but they're at the center of their child's kind of world right now. They're at the, at sort of having to be at the hub of both of education, resources, medical care. I mean, it's all really falling into the lap of the parents, and it can be very overwhelming. But I always really make it a point to just applaud parents for the amazing job they're doing, because they are doing a great job. Whatever it is that they're doing is good enough. And I always want to emphasize that point. So the first thing I tell caregivers, and this is, again, if you're a caregiver listening, I'm telling it you directly. If you're a provider listening, then I'm sort of, guiding you on maybe ways that you can talk to your patients about this. But the number one thing is self-care. So, we always talk about the cliche about in the airplane of putting our oxygen mask on first before putting it on our child. This is definitely true across the board, but in this time period, it's the most important truism that I can really try to reinforce with parents, right? So if you as a parent or a caregiver are not taking care of yourself by eating well, trying to exercise, sleeping well, then it's going to be a lot harder to take care of your child, right? And right now you are the one taking care of your child. Your child's not in school all day. So take care of yourself, whatever that means. And if that means 5-minute breaks in the bathroom, because that's the one place you get alone, to just clear your mind, do a quick, meditation, or just have a little break, then that's enough. That's okay if that's what you can do. But do what you need to take care of yourself. The second thing I recommend to parents is to try to keep some structure in the day, keep some semblance of a schedule. So what we know about kids with neurodevelopmental disabilities is that much of their education is really built around a very structured environment. So for instance, for our patients with autism, they often like visual schedules and really knowing in a concrete way what's going to happen at every step of the way during the day. It helps them feel, it just helps them feel more secure often. And that structure really actually mitigates behavioral challenges and tantrums and things that can occur when there's sort of uncertainty in the day. So parents can maintain that same level of structure at home. It's not going to be the same at school. You're not going to be doing classes every 30 minutes with very specific breaks, for lunch and recess or whatever else the day looks like. So that's okay. But whatever your day is going to look like, if you can create some sort of visual schedule and try to stick to a basic routine, that can be very helpful for your child. I particularly would say that the times of the day where it's most important to maintain a structure are the first couple hours of the morning and the last couple hours of the end of the day. The reason for that is that it makes sure your kiddo gets up on time and is active or is doing something to engage them in the morning. And then at the end of the day, also has a routine around bedtime. Because what those two bookended times provide is the most likely chance for your child to sleep well at night. And sleep is key. And that's my third point, right? So keep that structure, especially at the beginning and end of the day. What happens in the middle, it's okay if it's a free-for-all and it's a little bit chaotic. It is in all of our households right now. I completely get it. But if you can bookend the day with structure, very, very helpful. And again, which leads to my third point, which is sleep is key. I have been very aggressive with my parents about sleep hygiene during this time. That means if your child's on medications for sleep, or if your patient's on medications for sleep, those need to stay the same. And the routine around sleep needs to stay the same so that kids are sleeping well. Because as we all know, if we sleep well, we feel better during the day. With regards to medications as well, I always tell caregivers, make sure you stay on your same medication routine. Don't make changes just because your child's not at school and is in a different environment. Try to keep those medications the same. And then the last thing I tell, and this is true for all of us, I say this to my trainees, to my, my colleagues, my friends, as well as my patients, which is we all have to manage our expectations, right? We are not going to be able to recreate and recapitulate, the excellence of everything that your child is receiving or a child's receiving in their school and other interventional environments, right? So it's okay. Right? This is a tough time for many people. And what we need to do is manage our expectations and give ourselves a pat on the back for those small victories that we do have during the day. Because in the end of the day, it is a special time for all of our caregivers to be able to be with their child or adult with a neurodevelopmental disability. And we want to make sure that parents enjoy some snippets of that as much as possible. So with that, I'm going to take a pause. What I will say is that there's some great online resources for families of children or adults with neurodevelopmental disabilities that highlight some of the things I talked about, but in much more detail. There's also a lot of really cool resources for tele-interventions that are available. Some are in the context of research studies, some are in the context of just clinical service provision, and all of those are on the internet. Our UCLA Center for Autism Research and Treatment, UCLA CART, has a really nice resource page for families that you can access. If you just Google UCLA CART Autism, you will get to our webpage. And there's a link to COVID resources, and you'll see a lot of great resources that you can access either, again, as a healthcare provider or as a parent or caregiver. The other great resource page is the Autism Science Foundation. They have done an incredible job of building a lot of resources for families, and they actually divide it up by resources for families, resources for clinicians, resources for researchers. Because again, we all need, I think, extra guidance and help during this time. And then I'll just end by saying, our work never stops. I'm a clinician. I'm also a researcher, and I am continuing to do all of the work that I was doing in person remotely, possibly even more so because our families need us in this time, I think, more than ever. And so it's a big team effort, and we're excited to be a part of this effort as we move forward.